Welcome to TryRight. This is Pack 365. Myself Srija. So today in this session we are going to learn about some of the ICD-10 classification for the diseases of the nervous system. So coming to code G62. G62 is for other polyneuropathies. So what are other polyneuropathies? These neuropathies happen due to the external factors such as alcohol, toxins, nutritional issues and drugs. So what are toxins? These are poison exposure, nutrition issues like vitamin B12 deficiency and certain drugs or medications. So what is the example? What is the subcode of G62? It's G62.0, the drug-induced polyneuropathy. Drug-induced polyneuropathy is nothing but the medication causes the nerve damage. For example, when a cancer patient receiving chemotherapy, they develop tingling, burning or numbness in the feet or hands, then you have to assign the code G62.0. So this is the chemotherapy induced tingling and numbness. So coming to G63, it's polyneuropathy in disease classified elsewhere. Means this G63 code, it is used whenever another disease is causing the neuropathy. So what is the important rule over here? You must code the underlying disease first. So what disease is causing the neuropathy? You have to code that disease first. Then you have to assign the code G63. So this is the important guideline for G63, for assigning the G63 code for the diseases. So what will be the examples of G63? Diabetic polyneuropathy. So E11.42. So whenever diabetic polyneuropathy, it is causing the polyneuropathy, the diabetes condition is causing the neuropathy, right, over here. So you have to assign the code diabetic polyneuropathy first and then followed by G63 code. So this is an autoimmune disease causing the neuropathy. So the infection caused neuropathy, for example, HIV neuropathy. So first you have to assign the code for disease, then neuropathy and then G63 as a secondary code. So coming to G64 code, other disorders of the peripheral nervous system. So what do you mean by, so when this G64 is used, it is used when there is a nerve dysfunction, but it does not fit into any other category, G62, G63 category. So what are the examples of G64? A generalized nerve dysfunction and also the peripheral nerve disorder of the unclear cause. And the other example is the non-specific symptoms like numbness, but not linked to a non-specific condition. So what is the key idea over here? Nerve problem, but the category is not clear. So then you have to assign the code called G64. At the right side, you can see the picture of the diabetic neuropathy. So in this, what can you see in this picture? A diabetes shows, so this is normal blood flow, this is reducing blood flow, right? So here diabetes reduces the blood flow to the nerves. Then it leads to the nerve damage and then the nerves become weak. And what happens when the nerves become weak? It causes numbness, burning and ulcers on the feet. So this shows as the normal blood flow and versus the reduced blood flow with the damaged nerve fibers. You can see there is the damage of the nerve fibers over here. So this is about the diabetic neuropathy. And then next, G65. So G65 is for sequelae of inflammatory and toxic polyneuropathies. So what do you mean by sequelae of inflammatory and toxic polyneuropathies? So first, what is sequela? Sequela is nothing but the long-term effect that remains after the original condition has healed. So whenever the past condition is no longer active, but the patient still has the leftover symptoms, is nothing but the sequela. So when to use this G65 code? So you have to use this code after the initial toxic or inflammatory neuropathy has resolved, but the patient still experiences the continuing problems. Okay, so what will be the examples of sequela? A persistent numbness. So after a chemical or toxic nerve injury, you can experience a persistent numbness, or a foot drop following a post-inflammatory neuropathy, and also the weakness that remains long after the acute illness is gone. So what will be the key point over here? When the acute condition is gone, When the leftover symptoms remain, you have to use G65 code. You have to assign this code. So what are the disorders of neuromuscular junction and muscle? So this code ranges from G66 to G673. So what it is? So what does this mean? This group of codes involves the problems in nerve muscle communication, muscle weakness, myopathies is nothing but the muscle diseases, and also the abnormal muscle movements. So what is the code G66? Disorders of myoneural junction and muscle in disease classified elsewhere. So what does this mean? You have to use G66 whenever another underlying condition, like another underlying disease like infection or autoimmune disease or the metabolic disease, so it causes a muscle or neuromuscular junction. So for example, the muscle weakness due to a thyroid disease, neuromuscular junction problems caused by autoimmune disease, and also the muscle dysfunction caused by the viral infection. So these are all the examples of the G66 code. So you have to assign this G66 whenever the patient is diagnosed with the disorders of myoneural junction. Next, coming to G70. What is G70? It's myasthenia gravis and other myoneural disorders. So what is it? So these are the disorders of the neuromuscular junction. Okay, neuromuscular junction is nothing but it is a place where the nerve meets the muscle and tells it to contract. So if the junction does not work properly, the muscles become weak, especially after the activity. So G70.0, you have to assign the code for myasthenia gravis. So what is meant by myasthenia gravis? It's a chronic autoimmune disorder. The body produces antibodies that block the acetylcholine receptors on the muscle. Because of this, the nerve signal cannot activate the muscle properly. So what is the key feature over here? Fluctuating muscle weakness. Means weakness increases with activity and it improves with the rest. So what will be the common symptoms of the myasthenia gravis? You can observe eyelid drooping, nothing but ptosis, double vision, diplopia, difficulty chewing or swallowing, and also you can feel the weakness in facial muscles. So myasthenia gravis is nothing but it's an autoimmune disease. It affects neuromuscular junction and also you can see the fluctuating weakness. So in the right side, you can see the picture of myasthenia gravis. So it shows the what happens at neuromuscular junction. So what happens? First, the nerve cell releases the chemical called acetylcholine, and this acetylcholine it travels across the synapse and it binds to acetylcholine receptors on the muscle, and this binding it causes the muscle to contract. So what happens in myasthenia gravis again? So the body produces antibodies. These antibodies attach to the acetylcholine receptor and it blocks them. So because of this, acetylcholine cannot bind to the receptor. So because of this myasthenia gravis, this acetylcholine it cannot bind to the receptor. The muscle does not receive the full signal. So this leads to the reduced muscle contraction. You can clearly see in the picture the reduced muscle contraction. So the cycle becomes it nerves sends a message, receptors are blocked and muscle becomes weak. So what are the symptoms you have shown in the diagram? It's a drooping eyelid, weak facial muscles and difficulty smiling or keeping eyes open. You can also see the possible slurred speech or swallowing difficulty. So this is about the myasthenia gravis. So whenever myasthenia gravis is diagnosed, you have to assign the code G70.0. So next coming to G71 code. What it is, it's a primary disorder of muscle. So these conditions originate within the muscle itself, not the nerve, right? The name itself gives you the clarity. These conditions originate within the muscle itself, but not the nerve. So they usually involve the problems in muscle fibers, muscle proteins, or the muscle metabolism. For example, G71.0 muscular dystrophy. So what do you mean by muscular dystrophy? It's a genetic disorder causing the progressive muscle weakness and also the muscle wasting. So muscles in this muscular dystrophy, they gradually lose strength because the muscle fibers are destroyed over time. So what is a common example of G71? It's a Duchenne muscular dystrophy, nothing but DMD. So this DMD, it is most common in boys. So due to the mutation in the dystrophic gene, you can observe, you can get affected by this DMD. So children who are having DMD, they show difficulty walking, climbing stairs, and they may use a gover sign to stand up. So this is about the muscular dystrophy. So what will be the comparison between G70 to G71? G71, it's a nerve muscle junction. It affects nerve muscle junction, whereas G71 muscle itself. So this is often autoimmune. This is usually genetic, and here the weakness pattern is fluctuating in G70, whereas the muscle weakness is it's progressive in G71. So you have seen both the examples for G70 and G71 ICD-10-CN codes. So next, coming to G72 code, other myopathies. So what do you mean by other myopathies? So what do you mean by myopathy first? Myo means muscle, pathy means disease. So myopathy is nothing but a muscle disease. Muscle becomes weak, painful, or unable to function normally. So G72, this includes the muscle disorders caused by drugs, toxins, endocrine issues, and inflammation. For example, G72.0 is a subcode for G72. It is drug-induced myopathy. This means the muscle weakness is caused by a medication. Drug means medication, right? So muscle weakness is caused by a medication. For example, steroid-induced muscle weakness. So this is a long-term corticosteroid use. Whenever you use the long-term corticosteroid, so you can experience a steroid-induced muscle weakness. So this weakness caused by alcohol or smoking can also be coded under G72.0. So next, coming to G73. G73 describes the disorders of myoneural junction and muscle in disease classified elsewhere. So this category, it is used when another disease is responsible for the muscles of neuromuscular junction problem. So what is the meaning actually? It is a systemic disease. It causes a problem of the muscle or nerve muscle junction. So muscle weakness is secondary to the another medical condition. So what will be the examples of this G73 category? Myopathy due to thyroid disease, myopathy due to adrenal disease, and muscle problems due to the systemic autoimmune or metabolic disorders. So what is the most important coding guideline while coding the G73 code? So first you must code the underlying disease, because this is the main reason, right? When you take myopathy due to endocrine disease, so first you have to code the main disease. For example, the endocrine disease, and then you have to follow by the G73 code. This is the coding sequence. This is the coding guideline for G73. So cerebral palsy and paralytic syndromes, the ICD-10-CM code range is from G80 to G83. So what do you mean by cerebral palsy? So cerebral palsy, it's a non-progressive. It does not worsen with time. So it is caused by the early brain damage, usually birth or shortly after. So what are the effects of cerebral palsy? Movement, posture, muscle tone, stiffness or fluffiness. So what are the examples for cerebral palsy? G80.0, the spastic quadriplegic cerebral palsy. So what do you mean by it? The stiffness and movement problems in all the four limbs. So what is G80.1? It's a spastic diplegic cerebral palsy. Diplegic means both. Here quadri means four, right? So here the stiffness and movement problems occurs in all the four limbs, whereas in G80.1 the stiffness mainly occurs in only both the legs. That's it. So that's the difference between these two codes. And next, coming to G81, hemiplegia. Hemiplegia is nothing but paralysis of one side of the body. Either it may be left or right. So this condition, it is often occurred due to the stroke, brain injury, tumor, and also the brain infection. So what are the example? What is the subcode for hemiplegia? So G81.1, it's a flaccid hemiplegia. So what do you mean by flaccid hemiplegia? The affected arm or leg, it hangs loosely with no muscle tone. This is called as flaccid. Flaccid means loosely. So Example, limb hangs loosely after the acute stroke. So you can see the picture of cerebral palsy over here. Cerebral palsy is nothing but the brain condition causing the paralysis. So whenever damage happens to the brain, it affects the thoughts, the movements, vital organs, and also the loss of the muscle control. So next coming to G82, paraplegia and tetraplegia. So what do you mean by paraplegia? Para means both the legs, right? So these codes describe paralysis due to spinal cord injury and also the spinal diseases. So what they mean? Paraplegia means the paralysis of the both the legs, that is lower limbs. Whereas tetraplegia or quadriplegia is nothing but the paralysis of all the four limbs, like both arms plus both legs. So what are the common causes of the paraplegia and tetraplegia? The spinal cord trauma or fracture, spinal tumors, you can also see the spinal infections, and also the multiple sclerosis. For example, when you take G82.0 code for flaccid paraplegia, here the legs are completely weak, limb and no muscle tone is observed. So flaccid paraplegia is whenever it is diagnosed, you have to assign the code called as G82.0. So next coming to G83, the other paralytic syndromes. So this is used whenever the paralysis does not fit into the categories of G80, G81 and also the G82. So what does this codes include? These codes include diplegia, G83.0 code for diplegia, nothing but the paralysis of the two limbs, usually both the legs, but not due to cerebral palsy. So next code, so what are the subcodes of G83? G83.0, it's monoplegia of the lower limb. So here paralysis of the monoplegia of lower limb is nothing but paralysis of the one limb, usually one leg. So for example, when the one leg becomes paralyzed after a nerve injury, you have to assign the code G83.1. So next coming to G83.5 code, it is locked in syndrome. So it is much rare, but it's a severe condition caused by the brainstem damage where the patient is conscious and aware, but he cannot move any limbs. So they can usually only move the eyes or blink. So in the right side, you can see the types of paralysis: monoplegia, hemiplegia, paraplegia, quadriplegia. You can see the differences like how parts are paralyzed in different types of the paralysis. In monoplegia, you can see only one limb paralysis. The blue indicates the paralysis. So here one limb. In hemiplegia, the one side of the body. In paraplegia, both the legs. And quadriplegia or tetraplegia, all the four limbs are paralyzed. So these are the examples of the and types of the paralysis. So this is about the paraplegia, tetraplegia, monoplegia and hemiplegia. So next coming to other disorders of the nervous system. So G90 code. So what does G90 code include? So G90 is the disorders of the autonomic nervous system. So this autonomic nervous system, it controls the automatic body functions that we do not consciously think about, such as heart rate, BP, sweating, digestion and temperature control. So G90.0, it is for idiopathic peripheral autonomic neuropathy. So what do you mean by idiopathic? The cause is unknown. Whereas peripheral autonomic neuropathy means here the nerves controlling automatic functions are damaged. So symptoms like abnormal sweating, dizziness and standing, digestive problems. So these are the symptoms of this idiopathic peripheral autonomic neuropathy. So when coming to G91 code, it includes the hydrocephalus. So what do you mean by hydrocephalus? So hydrocephalus means the extra cerebrospinal fluid builds up inside the brain. So cerebrospinal fluid is present in brain, right? So the excess amount or the extra cerebral spinal fluid builds up inside the brain. So this called as hydrocephalus. So what does this do? It causes the increased pressure because the skull cannot expand, especially in the adults. So in the right side here, the child image, it shows you the enlarged ventricles, the bulging fontanelle and a shunt placed to drain the excess cerebrospinal fluid. You can clearly see it. And next coming to G91.0, it is a subcode for hydrocephalus. So what it is? Communicating hydrocephalus. What do you mean? So communicating means CSF, the cerebrospinal fluid, it can flow between the brain ventricles normally. So but the CSF is not absorbed properly. So it collects and increases the pressure. So this is nothing about the communicating hydrocephalus. So whenever a patient is diagnosed with the hydrocephalus and also the communicating hydrocephalus, you must assign the code G91.0. And next coming to G92, it's a toxic encephalopathy. So what do you mean? Encephalopathy means nothing but the dysfunction of the brain. So toxic means the caused by the harmful substances, for example, drugs, alcohol, chemicals, carbon monoxide poisoning. So what is the example of toxic encephalopathy? Confusion after the carbon monoxide exposure. So it fits under the G92 category. So what you have to remember in this slide, G90 for problems with the automatic body functions. G91, it's an extra cerebrospinal fluid in brain which where the pressure increases, and G92 for the brain affected by the toxins. And next G93 category, G93 code. So what do you mean by G93? It's other disorders of the brain. So what do you mean by other disorders of the brain? These are the brain conditions not classified in the other categories. For example, G93.0 for cerebral edema. So what do you mean by cerebral edema? It's a brain swelling, right? Edema means swelling. Cerebral means brain. It's a brain swelling. So what are the causes of cerebral edema? Trauma, stroke and infection. And also you can see the lack of oxygen. So the swelling increases the pressure inside the skull. So this can cause the damage to the brain tissue. So next subcode G93.2, it is benign intracranial hypertension. So pseudo is nothing but, it is also called as pseudotumor cerebri, right? So pseudo is nothing but false. So it looks like a brain tumor because of the pressure increases. But there is no actual tumor. So what are the symptoms of the G93.2? Headache, vision problems and nausea. So you have to assign the code G93.2 for pseudotumor cerebri or the benign intracranial hypertension. So next code is G94. So what is G94? Other disorders of the brain in disease classified elsewhere. So this code is used when another disease causes the brain damage. For example, HIV infection, it causes the brain dysfunction, right? So when cancer is spread to the brain, it causes the neurological signs. So G94, it is not used as a primary diagnosis. It is only used along with the another underlying disease code. Always it is used as a secondary code. Okay. So next coming to G95, it's other spinal cord disorders. So what do you mean by other spinal cord disorders? So these codes describe conditions affecting the spinal cord itself. G95.0 is a subcode. It is for syringomyelia and syringobulbia. So what do you mean by syringomyelia? A fluid-filled cavity called as syrinx, it forms inside the spinal cord or brainstem. So this cavity, it expands and damages the nerve pathways. So what will be the symptoms of the G95? The pain, muscle weakness, loss of sensation. And at the right side, you can see the picture of the syringomyelia. You can see clearly the spinal cord, the cerebrospinal fluid, the dura mater, and also the cerebrospinal fluid space. So example of G95, the subcode of G95 is G95.1 with vascular myelopathies. So what do you mean by vascular myelopathies? It is also called as spinal cord stroke. So vascular means nothing but blood vessels, and myelopathy is nothing but spinal cord damage. So when blood supply to the spinal cord is blocked, the spinal cord stroke occurs. So this leads to the sudden weakness, paralysis or the loss of sensation below the affected area. So coming to code next, G96. So what is G96? The other disorders of the central nervous system. So, for example, G96.0 for cerebrospinal fluid leak. So, these conditions, these are the central nervous system conditions that do not fit in earlier categories. So, G96.0 for CSF leak. So, what do you mean by CSF leak? A cerebrospinal fluid leak means the fluid escapes from around the brain or spinal cord. It escapes out. So, what will be the common places of the leak of the CSF? There, it might be nose, ear, usually. So it is caused by surgery and also trauma like accidents or head injury. So what is the subcode? So these disorders, what is the subcode of G96? G96.1, the disorders of meninges. So meninges are nothing but they are the protective covers around the brain and spinal cord. So these disorders, they are not due to infection, unlike the meningitis. For example, meningeal cyst. Meningeal cyst is nothing but the fluid-filled sacs in the meninges. So next, coming to code G97, it is for post-procedural disorders of the CNS. So these codes, they are used for the complications that happen after the surgery or the medical procedures involving the brain and the spinal cord. So G97.0 is for the CSF leak after spinal or brain procedure. For example, CSF leak after the lumbar puncture and also after the brain surgery. So you have to assign code G97 for the post-procedural disorders of the CNS. So next, coming to code G98, other disorders of the nervous system not elsewhere classified. So what do you mean by other disorders of nervous system? So this is a general miscellaneous category. This is used whenever the nervous system disorder does not fit into any other specific ICD code. Okay. So this is a general category. Whenever you don't fit any other specific ICD code, you have to assign this G98 code. And coming to the last code of the nervous system disease, G99. It is the other disorders of the nervous system in diseases classified elsewhere. This is used whenever the another disease causes a nerve system problem. So these are not specifically listed any other way. So for example, when diabetes causes the autonomic neuropathy. So diabetes is another disease, right? It is causing a nervous system problem. So then you have to assign the code G99. So this diabetes here, it's a main condition. It is coded separately, and autonomic neuropathy, it's a nervous system complication. So you have to use G99 together with the diabetes code. Okay. So this is about the G99 code description. Yeah, this is all about the ICD-10-CM classification of the diseases of the nervous system. So that is for today. I hope this session has helped you to learn about the diseases clearly and their ICD codes, how to assign the codes. In the next session, you are going to learn about the cardiovascular system anatomy and also the physiology. Thank you.